In today's episode, we'll discuss the key benefits and challenges of competency-based education, particularly in the context of medical education. Let's talk about holistic success. Hi everyone, I'm Kelly Dore, co-founder and VP of Science and Innovation at Acuity Insights. Welcome to this episode of the Holistic Success Show. Here with me today is Dr. Zafar Iqbal, research scientist at Acuity Insights. Zafar is a research scientist where he contributes to the development of the test content and improves practices and procedures for our Casper test. He's had over 10 years of academic experience, primarily focused on the continuous improvement of assessment practices. His areas of research include assessment, competency-based medical education, faculty development, and co-creation. Welcome, Zafar.
Thank you so much. Thank you for having me. It gives me a great pleasure to talk about an important topic, which is very close to my heart. So happy to contribute to this discussion.
I am so thrilled to have you here today, Zafar, because this is a topic, as you say, that is close to your heart. It's close to mine. I spent a lot of time in med ed working in competency-based medical education, thinking about how we implement it, how we evaluate it. And what became clear is that, this is a growing trend. We often thought about it in medicine, but more and more, both health specialties and other areas of education are starting to think about how they can implement competency-based education in their practices. So let's start, everybody, at the beginning. From your perspective as an expert in competency-based medical education, or CBME, how would you define or describe competency-based education?
First of all, I cannot agree with you more that CBME or CBE definitely is in trend and is expanding from one profession to another across the health professions, starting from medicine to others as well. As far as the definition is concerned, I would like to start with a quote from McGaffey and colleagues paper that was published back in 1978. They argued that ultimate goal of a competency-based program should be to develop professionals who can provide healthcare services at a defined level of proficiency and in accordance with the local conditions to meet local needs. They also suggested that probably having a universal definition of competency-based education is unnecessary at this point. And rightfully so, as we can see a lot of trends and disparities between the different definitions across the board. I mention this because it is also important that since the conception of CBME, there has been an ongoing debate at what is the best possible definition of competency-based education, specifically in health professions. So if I had to define it, then I would refer to the definition developed by Jason Frank and colleagues in their systematic review paper that was published in 2010 in Medical Teacher. Interestingly, they define probably in the same wavelength, but in a little bit more descriptive form. So they define CBME as an approach to preparing healthcare professionals for practice that is fundamentally oriented around graduate outcome abilities and organized around the competencies, which are the core of CBME, and that competencies should be derived from the societal and patient needs.
I love that because it really does pull together, sort of the goals of CBE is, having this alignment of what competencies folks should have as they're progressing through training or at the end of training. Now, you and I both know from lots of conversations with people in the community that there are maybe different perspectives on competency-based education in, how it might be applied in different settings and different contexts, but there are some core principles to competency-based education that really tie it together. Can you maybe review those for us?
Interesting. Thank you so much for bringing this important question, because I completely align with this fact that multiple principles have been highlighted in the literature, and there are some variations. But in principle, I would say that CBME has four main principles that lay down the foundation. So first of all, number one is the focus on outcomes. Unfortunately, not all the curricula or programs have explicitly defined outcomes, or they don't ensure that that their graduates have successfully achieved the outcomes that were defined in the program. which leads the programs to emphasize more on the process issues, for example, the content or instructional design, over the outcome. So, what a graduate is supposed to do, or what is the level of their proficiency at the end of graduation. So, unfortunately, because of these issues, we get a bit deviated away from the end goal and focus more on the process. Second fundamental principle is emphasizing on the abilities. So, program curricula must emphasize on the abilities that they wish the students to acquire. So, these abilities should be derived from the needs of those served by the graduate. This is extremely important to note, that the abilities should be derived from the societal needs or the people that these graduates will be serving in the future. So, in other words, what knowledge, skills, and attitudes would be required to achieve a certain competency level. In my perspective, it is totally up to the programs whether they want to develop these outcomes or abilities in house, or they want to use some already available national or international framework. Now, this is a different debate, that we want to use ready made frameworks or want to build in house. I don't want to go there, but I will just for the sake of reference, I can say, for example, CanMeds is a good example of a university accepted competency framework that is widely used in CBME in different professions and across the world. One thing that we can ask programs to make sure is that ensuring that whatever outcomes or abilities they want to design, they should be achievable, measurable, and observable, just to ensure a timely assessment over a period of time. I would like to add a third principle, which is de-emphasizing time-based education or time-based training. Now, this is something very controversial, which we will talk in the future probably. So, it is being said that programs using CBME approach should shift their focus away from time as learners spend on education unit or activity, and more focus on the learning that has actually happened. So, as you know, that current curricula and credentialing system tend to emphasize on the fixed time spent in the training, whereas we all know that all students do not have the same learning pattern. Some folks learn some skills quite quicker than the others. So it's natural to assume that all students or learners of a program do not have the same learning curve. So I think there needs to be a greater emphasis on the development progression of the abilities and on the measurement of the performance, instead of fixating on the time and saying that you have to achieve all the knowledge, skills, and attitudes required to achieve these abilities within this fixed period of time. And finally, the fourth print, not mine, of course, but fourth principle that I would like to highlight is promoting learner-centeredness. This is extremely important. As programs promote greater learning, engagement, and training, the better will be the outcomes of CBME. For instance, a curriculum of competencies provide clear goals for learners and milestones, thus providing them a transparent path to achieve these competencies. An individual learner can adjust their own learning using these maps of competencies and milestones. And I would like to add to this point finally, and I promise this is the last point, that uh, promoting learner centeredness in order to achieve this, an integral or probably the most fundamental thing to do is constructive feedback. Without feedback, probably CBME would be incomplete.
One of the things I want to highlight too is you talked about this need for transparency, which is something really that competency based education provides, not just for the learners, but also for the faculty, the staff members, et cetera. We know exactly what we need to do, whether we're a program in a very rural area or an urban area across different geographies. They know what they need to do. We will talk more about some of the complexities of CBE as we talked about, de-emphasis of time and what that means, because I think that's been interpreted a variety of different ways. But I think for you and I, as folks who play a lot in the area of admissions and work with different admissions programs, be that at the undergraduate or graduate level, think about how can we bring in folks with broad backgrounds and experiences. We know that they're going to come in with different levels at different stages. And so putting them through a cookie cutter approach is sort of counterintuitive to that goal of bringing in this broad spectrum of folks who are going to be able to serve our community to the best ability. And so I love the way that you sort of frame some of these principles too, because it aligns not just to that, but sort of to our broader goals in health professions education of ensuring that we're serving the community when we go back to that group as the key of the principles. I know we talked a little bit about frameworks, and thinking about competency-based education, be it in different ways. What are some of the key benefits that you see? We see this trend where more and more folks are considering different specialties, different groups are looking at implementing competency-based education. What are some of those benefits? Why are people moving in this direction?
I will just put a declaration out there that I am a CBME advocate. So giving you my opinion might be a little bit biased, but there are some established benefits in the CBME literature that I would like to highlight by connecting them with the four foundational principles that I just explained. So, for instance, number one that comes to my mind is that CBME provide a clear roadmap to all the stakeholders by outlining the end goal. I personally am very, very fond of having a clear understanding of where I'm supposed to go and how I'm supposed to go, so that I have a clarity in my mind how to reach to that goalpost. So learners know from the start that what they are supposed to achieve at the end of the training. And similarly, educators and curriculum planners can use the desired outcomes or abilities or competency framework, whatever they're planning to use, to better align the educational activities, instructional methods, and assessment. Now, this alignment between these three trika is extremely, extremely important to make that competency based framework practical in implementation. Second is its commitment to society. And as you very eloquently expressed it, societal needs are the key or center to CBME philosophy. So, CBME can prepare clinicians to serve their patients and communities to the best of their abilities. And that is probably why I strongly believe that if you are planning to implement CBME, then a best approach would be carefully considering the needs of your society or the community where your graduates will be serving instead of using some borrowed framework. I will stop there because obviously this is a little bit controversial, and we can uh, talk more about this. But uh, just to put the word out there, by defining competencies and milestones for each stage of the training program, probably I think CBME can promote vertical and horizontal integration of the training programs, which have been advocated by maestros like Harden since 1990s, early 1990s. So I think they provide a very CBME provides a very nice transition from undergrad medical education to residency programs and to even continuous professional development. And because of this reason, I think many scholars view CBME as a continuum of education. Finally, as I mentioned earlier, CBME is a method to promote learner centered curricula. And by providing experiences within a more flexible time frame and focusing on learner development, CBME can actually help learners to become truly engaged in the progression of their own competence over the period of time and at their own pace. So in CBME, transition from one academic year to another, or from undergrad to residency program, is based primarily on the evidence of skills rather than on predetermined time frame. In other words, time is just a source for education and not the marker of learning in CBME.
I think that was very well done, Zafar, because this is like complex topic, and so there are many benefits. We're gonna dig deeper into more, at least two more episodes on CBE. So if you're feeling like you want to learn a little bit more about some of the things Zafar's talking about, like EPAs and things, we are going to go into those in the future. But I do want to, before I let you go, we've talked about the benefits. We know you and I are both aligned that there can be some significant benefits to competency-based education, but it's not as easy as we would like it to be in terms of implementation. We've heard this from many colleagues across the world, and even in the literature and in discussions. So perhaps you can go through, some of the biggest challenges you've seen in the implementation of CBE or CBME as it's been applied in programs, because it's we're all still learning. I feel like is the answer there, but let's talk about some of those challenges.
100%. Thank you so much. I guess no education system is perfect, and it has its own potential challenges. Same is the case with CBME approach, to be honest and fair. I will highlight some of the biggest challenges I have noticed over time. So probably the first one and the foremost challenge that I can anticipate is defining and assessing the competencies itself. So for example, many programs struggle to identify the right amount of milestones and competencies that they can use throughout their training program. It has been a long-standing challenge. So for example, if your defined competencies are too small or arbitrary or too vague, then your learners as well as the faculty will struggle that how do we achieve them. And if there are too many of them, then probably it will lead to frustration within the learners and as well as the faculty, that how do we possibly achieve so many competencies or the milestones within one academic year. So finding a perfect balance is definitely a challenge. Second challenge is probably finding or designing the correct competency framework that meets your local needs. As I highlighted initially in my conversation, that indeed programs can adopt universally accepted frameworks that have been tried and tested over a period of time. However, a basic problem with that adoption is that they might not be adequate for your local needs, which is why I strongly emphasize on developing a national or local framework that meets the local community needs. The third issue that I often notice in my career is logistical issues. We know that many educational systems around the world are time based. They have fixed number of weeks for each rotation. They have fixed number of classes. They have certain credit hours to cover certain subjects, and rightfully so. So it remains a daunting challenge, in my opinion, that how can we transition to a time flexible, competency based system? How can programs actually manage the scheduling of hundreds or even thousands of training programs at their own pace? This is indeed a challenge. Similarly, how do we meet the demand of flexible training? How many institute
Yeah.
I can tell that many institutes don't have such extensive resources to monitor individual progress. For example, clinicians don't have enough time to supervise students or provide constructive feedback in addition to their clinical responsibilities. Lastly, I think the most crucial challenge is in CBME is false assumption that if you define or outline the competencies or outcomes, then probably CBME has been achieved. And I think this is a false assumption on a very large scale. Unfortunately, many programs outline the competencies and say that probably they have shifted from transitional to competency-based framework, which is not. The core of the training remains the same in such cases, which falsify the assumption that CBME has achieved. Because, in my personal opinion, outlining the competencies or the frameworks is just the tip of the iceberg. The actual essence of CBME, it's its procedural implementation.
Couldn't agree more, Zephyr. As I said, we're going to go deeper into these topics later on, focusing on topics such as implementation of CBME in undergraduate medical education, but also EPAs and the nuances of those, as you've just alluded to. How many should we have, etc. But I want to leave you with one final question for today. What are your top tips for programs who are considering going deeper with competency based education, learning about it, applying it, implementing it? Where do they start and how do they get going?
Great question. I think in my head, if I think about what programs can do potentially, I would divide it in three different phases. So from conception to planning to implementation, and fourth one probably to evaluation. I think a clear understanding, starting off, a clear understanding of what CBME actually is. This is extremely important for the programs. Like I previously explained, that it's not simply outlining the competencies; it's more like implementation. Second, I think it's extremely important that CBME should not be considered as a fashion and we need to adopt it. I think a rigorous need analysis to first understand if CBME is the answer to your program problems is the right approach. And in this approach, in this analysis, you need to evaluate if you have sufficient resources to implement CBME. So implementing CBME is resource intensive, as has been highlighted multiple times in the literature. It often requires more faculty time, new assessment tools, an ongoing curriculum adjustment, which is not easy. So, more importantly, as you can say, we are living in modern time and age. So, incorporating modern technology-based tools to track the learner progress is quite handy, but at the same time very costly and complex to manage. If by you I mean the programs, if the programs actually decide that they want to go ahead with the CBME, then which it would be fantastic. But I think then having a competency framework that they would use and how they would define, implement, and assess those competencies is extremely important. Uh, Another key area where I think many programs don't consider right from the very beginning is, do they have enough experts available in the house to support the implementation process, or you're going to seek help from external experts? Both are fine, both are good strategies, as long as you have a clear plan from the beginning. Another tip that I can give is that CBME demands systems level change, and such kind of changes demand time. So careful estimation of the feasibility is the key here. I think it's important that we prepare, and then implement, instead of implementing and troubleshooting later. And a very, very important point to consider, and I've kept it for the last, that moving to a CBME framework often requires significant cultural change within the institution. So this shift can be met, with resistance from the faculty as well as from the students who are accustomed to traditional educational methods, and they're like, we don't like this new baby. We like the old one." So it is very important, and I want to highlight before moving forward that there's an extensive body of research where different researchers have tried to explore the challenges that they have experienced at the student and the faculty level. So I think it is important, and of course we can refer to that literature, but it is very important that the faculty members, they are trained and supported in both the philosophy of the CBME and the practical aspects of implementation. So, for example, this includes developing new teaching strategies and more importantly, understanding why. Similarly, developing assessment techniques and providing meaningful feedback to the learners. We know very well that probably CBME is incomplete without constructive feedback and without helping the learners how to progress further. Finally, I think also equally important is student development and making them understand the value of CBME and the feedback. Unfortunately, students consider it an additional burden or responsibility that they have to track these competencies, and it is deviating them from the training program, and they are stuck in tracking their progress, but which is not the case. So it's important that students understand the value of CBM.
Absolutely. So for the level of change management that has to be done in order to implement it, as you say, plan, then implement is the way to go. And we will be linking a lot of the key resources that you mentioned in the show notes so that you can access those resources, read them for yourselves, go in a little bit deeper. But making sure that you're using resources like this to ensure if there's ways to educate your faculty or your students, make sure they have access to information. This is one of the most fundamental pieces, as you mentioned. Sometimes people are implementing CBE because they're being told to, and that's what they need to do. But they, seeking to understand the why behind it and making sure you share that. I love that point, Zafar. So thank you so much for sharing all of these insights. And what I can say is a great discussion, Zafar. I'm looking forward to our future shows as well. To all of you, thank you so much for watching and listening. If you haven't subscribed to our show already, please do so, and feel free to share this episode with any colleagues who maybe you're implementing CBE with, you're trying to get an understanding of it, or any of our other shows that might be helpful. And with that, we'll catch you in the next episode.
If you enjoyed this episode of the Holistic Success Show, please be sure to check out our other episodes. We have episodes coming out regularly all the time, so please be sure to subscribe so that you can stay up to date on all things related to student and program success in higher education.